We committed to ending it by 4:15 sharp, and we will. I know that several people have planes that are predicated on that assumption. And so this is our final panel prior to some brief closing comments. And this panel really is made up of very prestigious people in our world, in our industry. They're going to help us look at strategic opportunities, priorities, and commitments, and that will, I think, help us kind of bring together much of what's been discussed today. And both the panelists and the moderator of the panel really needs no introduction, but I'll do it anyway. That's Dr. Don Berwick, a good friend to many of us, a mentor and teacher, and President Emeritus and Senior Fellow at the Institute for Healthcare Improvement. Don co-founded IHI, as everyone knows, and led IHI as its president and CEO for 18 years. He's also widely regarded as both the nation's and the world's foremost expert on healthcare quality and improvement. And in 2010, President Obama appointed Don to the position of administrator for the Center for Medicare and Medicaid Services, which he held until December of 2011. His background is in pediatrics, healthcare policy, and management. He's been an outstanding clinician, educator, policymaker, and most importantly, a leader and teacher. Has many awards. I won't name them all, but if you're looking for an honorary knight commander of the British Empire, he's sitting right here. So, Don, thank you.
Thanks, Gary. Thank you all. It's a pleasure to be here with you all, so many friends in the room, including the panelists here. And I'm going to get out of their way very quickly. I'll make very short introductions with no disrespect to them, just to give them time to talk. A few reflective comments first. I think the purpose of this panel is, as Gary said, and I'll frame it partly to extract themes from the day so far. What did you hear that's cross-cutting and memorable? And remember, we're advisory to the committee, and I think that that's it's important for you to pull no punches in saying what you thought you heard. The committee should take under advisement, and also the future. You know, what are the implications of what we heard today for future steps to take? A couple of framing comments. First, I somewhat self-centeredly, I want to correct the record on every systems are perfectly designed to achieve the results it gets. I did not say that first. Paul Batalden did, I believe. I emailed Paul this morning just to check. He thinks he thought of it. So it's not me, definitely, and I think we can give Paul the credit. The triple aim, which Victor mentioned this morning, is not mine either. Tom Nolan and John Whittington are the authors of that. I was the first author on the relevant paper in Health Affairs, but that came from the same Tom Nolan you just heard from and his colleague John Whittington. So record straight. I'm sitting here feeling really good about connections between what we're doing and history. I'm not that old, but I'm old enough to have seen tectonic changes in the way healthcare thinks about its own work. Of course, prior to my time on the earth, medicine became scientific. The age of molecular biology entered, and it was embraced. A really important and quite memorable era for me that I do remember is the introduction of statistics into medicine. In our academic environments, in our journals, in the way we think. That we didn't take that for granted. That took leaders. It took, Paul Beeson and Alvin Feinstein and others who really insisted we had to get clear about how we make inferences. There was the entry of general thinking, general medicine thinking. That was an epochal change. We didn't have general internal medicine in our nation 30 years ago. And then it came and became a central piece to our clinical enterprise. I see what's happening here as about equivalent to the entrance of statistics and statistical thinking into healthcare. This is systems thinking in healthcare. And just like statistics pre-existed healthcare's discovery of it, the systems engineering and human factor stuff we're learning pre-existed by decades. Healthcare's growing discovery of this field, but I think we're seeing the same thing. And I'll bet that it's going to feel like that in 10 or so years, and probably as a result of this committee's work, where we now begin to understand as a human enterprise that we better take advantage of this area of knowledge in order to do better for the people in the communities we serve. Systems views, human factors, engineering sciences. They belong in healthcare at a level they've never been before, and they're going to make an enormous difference. That said, we do have a problem. It's recurrent, and that, I would say, is the pace and deployment of that knowledge. So although we have emerging some really thrilling examples, you've heard some today, of places that are starting to grab it and really make it work. Patty Gavo has done that at Denver Health, I know, and what Virginia Mason has done with production is incredible. But that's not the solution, obviously. That's the hint of solution. But one of the things I'm going to be thinking about, and hope our panelists will comment, is there any way to accelerate the embrace of the sciences of systems in the kind of care we give? And I don't know the answer to that, but I think we ought to be thinking about it. I've got many other reflections. I've learned a lot today, but I think I'll get out of the way of the panel. The panel are all friends. Maureen Bisignano is the current President and Chief Executive Officer of the Institute for Healthcare Improvement. She was my successor in that leadership role and also my best colleague and teacher for the years I was there. Maureen is a nurse by training, also a CEO of hospital CEO prior to that. She was the head of the healthcare practice of the Duran Institute. She's on a number of boards and a constant contributor, both at the IOM and generally in healthcare leadership. And I can't wait to hear what she has to say about this. Chris Jasinski, I've known for a long time. We go back remarkably long way. She's vice president now of professional satisfaction at the AMA. Prior to that, a general internist in Iowa, and she's served in leadership roles in clinical medicine in many ways. And look forward to hearing your comments, Chris. And I've known Bob Dittus the longest, I think, of any of these people. Bob and I go way back. When we were children, we were in the Society for Medical Decision Making. Indeed, I think we're in the founding group there. And I've watched Bob's career as a leader in thinking about diagnostic decision making, decision theory, and his leadership in healthcare. He is a professor of medicine and vice chancellor at Vanderbilt, and continues to be very active in the fields of health services research that were part of my career. And he also has headed part of the VA Quality Scholars Program, which is an amazing effort to really bring young clinicians into the modern world of thinking about systems and the kind of thing we're exploring. So what my assignment to you is to say anything you want, but include, if you would, remarks on what you think you learned today, and especially the future steps we need to take. Maureen, you want to start?
Sure. Thanks, John.